Right now, 1 in every 3 people over 40 is walking around with cholesterol plaques building silently inside their arteries. No pain, no warning signal, no alarm. Just a slow, quiet narrowing, year after year, until one day someone collapses and everyone calls it sudden. It was not sudden. That process had been running for decades. Here is the part that should stop you cold. You can slow it down and, in many cases, push back against it with 4 foods. Foods you can buy at any grocery store for under $2 each. Not supplements, not prescriptions, food. Backed by clinical research, not advertising copy. I am Dr. Deborah. Your next doctor's appointment will not cover any of this. Stay with me until the very end because the 4th grain is the one Japanese physicians specifically recommend to elderly patients to protect the brain. It is the most important one, and almost nobody is talking about it. But before we get into it, drop a comment right now. Tell me your name and where in the world you're watching from. I read every single one. I want to know exactly who this community is. Name and location. Go. Before the 4 grains, you need to understand what is actually happening inside your vessels. Because if you understand the mechanism, you're not just eating breakfast, you're making a deliberate medical decision. Cholesterol is not poison. Say that again to yourself because 30 years of medical marketing have done serious damage to that concept. Cholesterol is a substance your body cannot live without. Every cell membrane is built from it. Your sex hormones, estrogen, testosterone, progesterone, are synthesized from it. Your adrenal glands depend on it. Your liver uses it to make bile. Your body uses it to produce vitamin D. Cholesterol is a construction material, not the enemy. So what is the real problem? The problem is not the presence of cholesterol, it is the conditions under which cholesterol begins depositing on artery walls. Here is what most doctors do not explain, even during a paid appointment. Cholesterol does not stick to healthy vessel walls, it responds to injury. The inner lining of your arteries, called the endothelium, is 1 cell thick. When that lining gets a micro-injury, immune cells rush in. Cholesterol follows, acting as biological spackle, sealing the breach. That is exactly where a plaque begins to form. Atherosclerosis is not fat stuck in a pipe, it's a chronic inflammatory disease. Cholesterol plays a role, but inflammation is the original trigger. What injures the endothelium? 3 things. 1, chronic inflammation from infections, autoimmune conditions, smoking, or long-term stress. 2, elevated blood sugar. Sugar molecules physically scratch the vessel lining. This is why diabetics develop atherosclerosis several times faster than the general population. 3, a diet chronically low in fiber and antioxidants. That 3rd one is exactly where whole grains become a clinical tool. Soluble fiber, the type that dissolves in water, does not get digested in the small intestine. It forms a viscous gel. That gel traps cholesterol molecules in the gut and prevents absorption. They leave through your stool. No drug required. Simultaneously, that fiber feeds your gut bacteria. A healthy microbiome reduces systemic inflammation, the same inflammation that damages the endothelium in the first place. 2 directions, 1 breakfast. Let us go through each grain. Grain 1, buckwheat. Most households cook buckwheat wrong. One preparation mistake wipes out a significant portion of its benefit. I will show you the correct method in a moment. The primary active compound in buckwheat is rutin, a flavonoid, a plant-based bioactive compound. Rutin strengthens the walls of your capillaries, your smallest vessels, and increases their elasticity. Rigid capillaries crack easily. Every crack is a potential plaque site. Research shows rutin suppresses cardiac hypertrophy, the abnormal thickening of the heart muscle triggered by angiotensin II, a hormone that raises blood pressure and strains the heart chronically. Rutin is also a potent antioxidant. It neutralizes the free radicals that oxidize LDL cholesterol. Oxidized LDL is dramatically more aggressive at embedding into vessel walls. Stopping oxidation is almost as important as lowering the level. Studies show buckwheat reduces a fat oxidation marker called TBARS by nearly 30%. That is a measurable reduction in the oxidative stress driving plaque formation. Buckwheat is also dense in magnesium and potassium. Magnesium relaxes the smooth muscle and vessel walls and lowers pressure. Potassium helps the kidneys clear excess sodium, also lowering pressure. Natural combination therapy for hypertension. A case from my practice. I had a 63-year-old patient, hypertension, poorly controlled despite medication, repeated dose increases. I added one thing, buckwheat prepared correctly, daily. 2 months later, blood pressure stabilized, medication dose reduced. Not magic. That is what happens when nutrition and treatment move in the same direction. The recipe. Write this down. Buckwheat soaked overnight in kefir. Kefir is a fermented dairy drink near the yogurt section at most grocery stores. 150 grams of whole grain buckwheat, roughly 3/4 cup. Rinse 3 times until water runs clear. Add 250 grams of low-fat kefir, 1 to 2% fat. Pinch of salt, 1 teaspoon of cinnamon. Cover, refrigerate 8 to 10 hours. In the morning, soft, tangy, filling. Done. Why not boil it? Buckwheat's outer shell contains phytic acid, which blocks mineral absorption. Overnight in kefir breaks that down. The magnesium and potassium become bioavailable, actually absorbed, not just passing through. The cinnamon is not flavoring. Its polyphenols increase insulin sensitivity and blunt the post-meal blood sugar spike. Stable blood sugar, fewer micro-injuries to the endothelium. Everything connects. Grain 2. Oatmeal. This is the most studied grain for cholesterol management in the scientific literature. Dozens of randomized controlled trials, gold standard evidence, all pointing in the same direction. The active compound is beta-glucan, a soluble fiber with a unique molecular structure. In the intestine, it forms a dense, sticky gel that traps cholesterol molecules. They cannot be absorbed. They leave through your stool. But there is a second mechanism. Your liver produces bile acids using cholesterol as raw material. Normally, those bile acids get reabsorbed and recycled. Beta-glucan binds them too, blocking that recycling. The liver has to make new bile acids. It pulls more cholesterol from the bloodstream to do it. Both mechanisms drop your LDL simultaneously. A meta-analysis in the American Journal of Clinical Nutrition, 3 or more grams of oat beta-glucan daily reduces LDL by an average of 0.25 millimoles per liter. A separate clinical study found 4 weeks of beta-glucan reduced LDL by 6% and cut calculated cardiovascular event risk by 8%. One properly prepared serving delivers 4 grams, enough to trigger both mechanisms. Here is the trap most people fall into. Instant oatmeal packets are not the same food. Industrial processing reduces the molecular weight of beta-glucan. It is high molecular weight beta-glucan that produces the strongest effect. You need whole rolled oats, minimum 15 minutes of cooking. That is not a preference. It is clinically significant. Recipe: oatmeal with turmeric. 100 grams whole rolled oats in 250 milliliters water. Cook on medium heat, 15 minutes, stirring slowly. Add 100 milliliters milk, half a teaspoon turmeric, 1/4 teaspoon ginger, 2 or 3 pinches of black pepper. Cook 3 to 4 more minutes. Off heat, stir in 1 teaspoon of flaxseed oil. Why this combination? Turmeric contains curcumin, a powerful anti-inflammatory that blocks the signaling molecules promoting cholesterol adhesion to the endothelium. Now you're working 2 mechanisms, clearing cholesterol through beta-glucan and suppressing vessel wall inflammation through curcumin. But here's what most people miss entirely. Curcumin on its own has terrible bioavailability. Without anything else, almost none of it reaches your bloodstream. It passes through unused. Black pepper contains piperine, which increases curcumin absorption by 20 times. Without the black pepper, the turmeric is decorative. That is not an exaggeration. That is the biochemistry. Ginger improves peripheral circulation and has its own anti-inflammatory mechanism. Flaxseed reel provides omega-3s, lowering triglycerides and reducing blood viscosity. Your blood flows more freely. Grain 3. Millet. Millet got pushed out of most kitchens. Most people remember it as bitter. The bitterness is real and completely fixable. 3 rinses under cold water. That's all it takes. Millet contains lecithin, a phospholipid that helps the liver process fats correctly and prevents fat accumulation in liver cells. When the liver is burdened by fat buildup, a condition called hepatic steatosis, it produces more LDL and less HDL. Lecithin from millet blocks that shift before it starts. Millet also contains silicon, essential for collagen and elastin synthesis, the proteins that give blood vessels strength and flexibility. As we age, collagen production drops, vessels become rigid. Dietary silicon partially compensates, slow benefit, but real and cumulative. And millet is high in magnesium. Magnesium competes with calcium at the cellular level and relaxes the smooth muscle in vessel walls, reduced vascular tone, lower blood pressure. Magnesium deficiency is one of the most widespread and underdiagnosed conditions in adults over 40. Most standard blood panels do not accurately reflect tissue magnesium levels. You may have it and not know. Recipe: millet with lemon and sea buckthorn. 100 grams millet, rinse 3 times, non-negotiable. Boil 250 milliliters water, add millet, cook 15 minutes on medium heat. Add 100 milliliters milk, cook 10 more minutes until soft. Squeeze in juice of half a lemon, add 1 teaspoon sea buckthorn oil or a handful of the berries. Sprinkle 1 teaspoon of ground flaxseed. Lemon delivers vitamin C, a frontline antioxidant. The threat is not cholesterol, it is oxidized cholesterol. Vitamin C intercepts that oxidation. Sea buckthorn oil is one of the richest natural sources of fat-soluble vitamin E and a broad range of omega fatty acids. Vitamin E protects the endothelium directly, right at the vessel wall surface. Flaxseed adds soluble fiber and omega-3s. 3 grams of flaxseed adds 1 more gram of soluble fiber on top of what the millet already provides. Grain 4. Pearl barley. This is the one I mentioned at the very beginning. Pearl barley. Most people dismiss it. It takes longer to cook, unusual texture. But pearl barley is the most powerful grain for the blood vessels of the brain. It is specifically pearl barley that Japanese physicians recommend to elderly patients for the prevention of dementia and memory decline. Here is why. The brain is 2% of your body weight. It consumes 20% of all your oxygen and glucose. It runs entirely on blood supply. Any reduction in cerebral blood flow produces cognitive decline, memory loss, reduced concentration, slower processing. This is not a distant risk. It is a direct linear relationship between vascular health and mental sharpness in your 60s, 70s, and 80s. Pearl barley contains lysine, an essential amino acid your body cannot produce. It must come from food. Lysine is a primary building block of collagen. Collagen forms the structural scaffold of vessel walls, especially the delicate capillaries supplying brain tissue. Without enough lysine, those capillaries become fragile, prone to microtears. And microtears, you know this now, are exactly where plaques begin. The brain is particularly vulnerable because its capillaries are among the finest in the body. Pearl barley also contains selenium and vitamin E, both powerful antioxidants that protect vessel walls, brain cells, and cholesterol molecules from oxidative attack. Recipe: pearl barley with ginger and cinnamon. The night before, Rinse 100 grams of pearl barley. Soak in cold water 8 to 12 hours. Mandatory. Without soaking, it stays tough even after long cooking. Morning. Drain. Add 300 milliliters of boiling water. Cook on medium heat 30 to 40 minutes until fully soft. Into the finished porridge, stir in 1 teaspoon of freshly grated ginger and a pinch of cinnamon. Do not cook the ginger. Heat degrades its active compounds. Add it after. Ginger contains gingerols and shogols, compounds that improve blood rheology. They reduce viscosity and help blood flow more freely through the brain's finest capillaries, less prone to microclots. Cinnamon reduces postprandial blood sugar, the glucose spike after eating, stable blood sugar, less endothelial damage, fewer plaque sites. The whole chain connects. One more thing, clinically important. The rate at which plaques form and how much dietary changes can push back against them depends heavily on age. Before 40, the endothelium regenerates quickly. Deficiencies do not compound fast. After 45, collagen synthesis slows, hormonal profiles shift, plaque progression accelerates. After 60, antioxidant defense systems lose efficiency. In adults over 65, atherosclerosis of the cerebral vessels is found 3 to 4 times more frequently than in people at 40. The same food in the same person has a different level of impact depending on where they are in that timeline. How old are you? Drop your age in the comments. I want to see exactly which groups are watching. It will shape exactly what I cover next. Here is what you do now. 1. Stop blaming cholesterol. Chronic inflammation and vessel damage are the enemy. Everything today targets the root cause. 2. Rotate 2 or 3 of these grains into your weekly meals. You do not need all 4 every week. Consistency is the mechanism. Most people notice a difference in energy and digestion within a month. Blood work shifts around the 3-month mark. 3. Use the recipes exactly as written. The cinnamon, black pepper, kefir, ginger, sea buckthorn, they are not garnishes. Every ingredient has a documented mechanism. Every single one earns its place. 4. If you are on a statin, do not stop it based on this video. Nutrition works alongside medical treatment, not instead of it. Speak with your physician. 15 years of seeing patients has taught me this. The information that moves the needle is rarely what you get in a 7-minute appointment. There is no billing code for a conversation about pearl barley. If this reached you, share it with someone who needs it. Subscribe, leave a like. I'll see you in the next one. And if this reached you, help Dr. Deborah reach 1,000 subscribers, because this is exactly what 1,000 people need to hear.